Good, okay. So it's very hard to do this presentation when I'm looking at the ocean over here. So I'll try not to get, there's a lot, it looks beautiful out there, and it's too bad that we're in here. Well, I shouldn't say that, I guess. But anyway, so it's my first time presenting at the ICE, and I'm very humbled to be here. This is a great conference, and one I've always wanted to go to. So I'm definitely glad that I'm here. Very humbled, like I said, to be here. I'm a farm kid from Indiana, so being here to present to all of you is definitely a great honor, and definitely excited to be here. So about kind of how I started in imaging and things like that. So I was basically a dumb high school kid and didn't know what I wanted to do. So I thought, well, I want to do something in healthcare, and I always enjoyed taking care of people and things like that. So my mom says, well, hey, try out X-ray. And I was like, well, okay, I can probably do that. My aunt was an X-ray tech for forever, 30, 40 years probably. And it's like, okay, I'll definitely try this out. So went to Indiana, which is the best college ever. But I'll talk about that here in a little bit. But anyway, so then when I was at IU, I volunteered at Riley Children's Hospital. It's a Children's Hospital in downtown Indy, and volunteer in the ultrasound department. And I was like, well, this is pretty cool. So I just kind of brought patients back, got them prepared, things like that. And I thought, man, this X-ray thing's pretty neat. So as time went on, I was a CNA. So I worked at a nursing home as a certified nursing assistant. Worked at a nursing home all through college, and I love to mentor teenagers, kids. They are our future, obviously, but I always tell them that, if you're going to go into healthcare, get a job as a CNA, because it's a great experience. It kind of teaches you how to deal with patients and difficult people and things like that. So I was there when I got finished with X-ray school, which I have to agree that I partied a lot in X-ray school. It was probably the best time of my life. But when I got done with my associates, I decided to go and get my bachelor's in MRI and CT. So when I got out, I worked at Lafayette, Indiana. I did an MRI there, and then as time went on, I got promoted, I guess, to the chief MRI technologist. And then within a couple of years, I was over MR and CT. Then I went and got my my master's while I was doing all that. Ended up at Witham Hospital, and that's kind of my home hospital. I was actually born at the place that I work at, so that's kind of cool. So I was there, and I started off at the imaging department there. As time went on, I was over more departments, so got cardiology, and I don't know, I got a whole list of them. Then as time went on, kind of some people asked me, how'd you get this, chief patient experience officer role? And basically, I kind of say, well, this is how I got it. So I went from 92.9 in one quarter up to 96.1. So what happened was administration saw that, and they're thinking, wow, we need to kind of make this guy over patient experience. So I was like, okay. So I went and trained the whole hospital on AIDIT, and those of you might have heard of that, but it's a kind of a patient interaction tool, how you interact with a patient. So I did that. I kind of formed a team, and then we trained the whole hospital on AIDIT, on patient satisfaction. And when we did that, the scores went up again. So that was obviously a great thing. So that's kind of what led me to the patient experience realm. As time went on, they gave me this fancy title, Chief Patient Experience Officer. So it's like, okay, whatever. But we do get paid based upon our patient experience. The HCAHPS, some of you might have heard of that, but that's the inpatient patient satisfaction scores. And we do get reimbursed on that as part of value-based purchasing, okay? So that's kind of how I got into the whole patient experience realm. I'm from Witham Hospital. It's a less than 100-bed hospital. I think we're 90 something right now. We keep on adding on. We're in a very progressive part of Indiana, about 40 miles north of downtown Indianapolis. So I've been there for I think 11 years, It'll be 11 years in July, I believe. I'm also a member of AHRA. I'm a board member of AHRA. I do a lot of stuff with AHRA. So I really tell you that if you're not part of AHRA, you should be a part of AHRA. But also a huge basketball fan, and this looks like the basketball goal that I used to shoot hoops on back when I was a little kid. Dad had a basketball goal out in our backyard. I grew up in the country, so that's a cornfield back in the back there. But huge basketball fan, have a lot of passion for basketball. Big IU basketball fan. So does anybody know what this is? And Andrew, don't answer it. What? This is IU's coach, which is who? Oh, come on. Somebody said Bobby Knight. And he's throwing a chair, right? So a lot of people think Indiana basketball, they think of that. But huge basketball fan. This is Christian Watford hitting the last second shot that beat #1 Kentucky in 2000 something. But I was at a bar when he hit that shot, and it was like, that's pretty cool. You know, the whole bar went crazy when he hit that last second shot. But anyway, so enough about me. Well, no, we're going to still talk about me. So all right, so this is not me. So I'm a swimmer. I love to swim. That's Michael Phelps. I don't swim like Michael Phelps, but I swim so much my hair is turning colors. Used to be dark brown. Now it's all of a sudden blonde swimming. But I love to swim, love to cycle. Also love to run. So I am a triathlete. I've done a couple of them. Well, actually more than a couple. 4, 5, 6, something like that. So also a big Forrest Gump fan. So so I got some Forrest Gump trivia for y'all. That's my Southern accent. So when bullies were chasing after Forrest, what did Jenny yell here during a scene? Okay, I think you said it first, Nathan. So he's got a Forrest Gump ping pong ball. Oh, there you go. And Forrest Gump's paddle was called what? His ping pong paddle. It was made by who? Flexolite. All right, that's just some trivia there for you. So anyway, all right, so here we go. So we're going to talk about patient experience here. So these are the objectives. I'm going to talk about where all the patient experience, and it doesn't matter what role that you're in. If you're in healthcare, whether it's on the service side, whether you're a director, whether you're in biomed, we're all here for one thing, and that's the patient. We're going to talk about care versus caring. There is a difference in care versus caring. Why patient experience? Talk about the financial Scanxiety. Scanxiety is a relative new term, and we're going to spend a lot of the presentation talking about Scanxiety. Empathy, you're going to hear that word probably 10, 11, 12, 20 times throughout my presentation. Empathy is so important, and we're going to spend a lot of time on that. Heart, heart is how we respond to concerns and complaints. Do we have anybody from Cleveland Clinic here? Probably not, no. Okay. Cleveland Clinic, they developed heart, so I respond to concerns and complaints. Aid it, that's again, I've mentioned that before, but it's a kind of a patient communication tool. Culture, so it's so important that if we build a culture based upon patient experience, so that's extremely important. Accountable, when we talk about culture, we got to make sure everybody's held accountable. So we're going to talk about those things. So this is a quick poll here. So why did you choose a career? Where did you choose healthcare as your career? You want to help patients? Somebody raise your hand. You like taking care of patients? You want to make a difference in a patient's life? You love patient care? Or some people didn't raise your hand at all? Well, there is no right or wrong answer, and actually they're all right, because if you're not here for the patient, then you're in the wrong field, okay? So we're all here for the patient. It doesn't matter if we're in accounting, if we're in housekeeping, if we're fold linen, we're all here for one thing, and that's for the patient. So customer service is an interaction between patients, coworkers, and anyone. So any person you come into contact with during your day, that's your customer. So you know, we have a lot of sales reps as directors, have a lot of sales reps come to us. They're our customer too, so they're just as important as what our patients are. Our coworkers are just as important as what our patients are, okay? So we got to make sure we treat them with the courtesy and respect that we would anyone. So that's customer service. These are some of the expectations that patients have here. So the expectations that patients have, they base their expectations on their prior experience. So if someone has a good prior experience, then they're going to base their healthcare decisions on that prior experience. Word of mouth, I have no stats to back me up on this, but I would say word of mouth is probably your best marketing tool. So as directors and salespeople and biomed people that we have, word of mouth is huge. So especially if you trust someone and you respect someone, then word of mouth is big. I know whenever I buy equipment, I always contact other directors. Hey, what do you think about this portable? What do you think about this MRI type of thing? So word of mouth is very important. The use of social media. I think I'm the only guy that's not on Facebook, but social media is really important to you. Patients look at social media. The advertising, that's important. People base their experiences on that. Quality websites. So when I say quality websites, that's not necessarily the nature of quality, but it's the quality websites that the government puts out there. ARC is one of the quality websites, AHRQ, I think. I don't know what it stands for, but I know it's a quality website that the government puts out there. So people do look at that, look at the news, so kind of see what's going on. Wellness, so they want to come to a place that promotes wellness. Competency and safety. So patients want to go to a place that the staff is competent. I don't want to have heart surgery at a place that is not competent with their cardiology department. So they also want to feel safe too. Okay, nobody wants to go to a place that they're not safe. Technology, they want to go to a place that's got the technology, the latest and greatest. Do you have a 3T scanner? Do you have a 256 slice CT scanner or higher? They do look at that. They want access, they want timeliness. So they want to come to a place that has, they can get in and out. They want to be scheduled quick. They want to get in and out quick. They don't want to wait, things like that. But what patients want the most is to be treated with courtesy and respect. So that's something that we all need to make sure that we're aware of. Okay, that's what patients want ultimately, is be treated with the courtesy and the respect that they have. We're going to talk about care versus caring, and there is a difference between that. The care is the services rendered by members of the health professions for the benefit of the patient. So the care is the lab, the radiology, the rehab, the audiology. That's considered the care, okay? You come to the emergency room with a broken toe, okay? That's the care. But the caring is more of an interpersonal process involving an emotional commitment to and a willingness to act on behalf of a person who has a significant relationship. So basically the caring is how well you care for the individual, okay? So there is a difference between the care and the caring. And when we talk about patient experience, we want to be the caring portion of that, okay? Again, the care is important. We definitely need to care. But when we talk about the patient experience, the care is important. I read a lot of patient satisfaction books. So this is one of them, the 15 best practices here. So I guess I'm kind of a nerd when it comes to stuff like this, but I've got to bypass my time. Over 6% of patients define the patient experience in a healthcare setting by how well they were treated as a person. That's the caring, and not the actual medical treatment itself, and that's the care. So that's a very good quote that I got from that book. Here's another good book too, Managing Patient Expectations. The technical and diagnostic skills are important. Again, that's the care, but patients do not assess them as quickly as they do the quality of the interactions, and that's the caring. So I can maybe get the perfect lateral chest x-ray on a patient, okay? But the patient doesn't understand that. The patient understands the caring portion, how well I interact with the patient. That's what the patient understands most, okay? So again, those care skills are important. If we didn't have the care skills, we wouldn't have the MRIs, we wouldn't have the CTs, we wouldn't have the artificial intelligence. But the caring portions is what the patient's going to go home and talk to their friends and family about. So there is a kind of a different correlation between the left brain and the right brain when we talk about the caring. So the left brain, that's more of the thinking portion. So that's what you think with, okay? So that's kind of the service delivery. So the left brain is what we're thinking about, okay? The right brain is more of the service excellence, okay? So our right brain is the caring portion. The left brain is the care portion, okay? So the left brain is more of the mechanics, and the humanics is part of the right brain, okay? There's times that there is, a left brain versus right brain competition, and I'm one of those guys that love competition, but there is a competition between the two, and I just think that's kind of cool. Those guys laugh at each other, I don't know. But anyway, so there is a little bit of a competition between the left and the right brain. But one thing I want people to understand is that the left brain is definitely not the enemy, okay? We need the left brain, okay? So the left brain, especially in radiology, is very important. That's how I think radiology is a very skill-oriented place. But so we definitely need the left brain. So again, we definitely need that. It ensures safety and quality, okay? So those quality websites I talked about, those wouldn't be possible if it wasn't for our left brain. However, we must try to transition more to the right brain when we're talking about patient experience, okay? So we got to kind of train our brain to go more left, right, but as far as the patient experience goes, we need to go more on the right. I was talking to somebody today, actually Jason in the back, but I was talking to him, and I've never known anyone that ever got fired yet that because they're a good tech from a technical standpoint. People get fired because of their right brain about the caring. At least that's what I found out. Now you guys might think differently or whatever, but the things that I found out, that's kind of what I've kind of noticed throughout my 20 plus years of experience anyway. So why patient experience? Why are we talking about this? So it's the right thing to do, and there is a direct correlation between patient experience and all of these factors here. So improved quality and safety outcomes. There is data out there that says if your patient satisfaction scores are high, then your quality and your safety outcomes are going to be high too. Improved employee satisfaction and retention, and we're going to talk about that here shortly, about the retention for the employees. Employee satisfaction is very important. Financial, we'll get that out here in a little bit, but again, if you're an outpatient or if you're an inpatient at a hospital facility, you do get reimbursed based upon your patient satisfaction scores. The market share. So where I live, and I'm sure everybody knows about this too, but anyway, I live about, again, 40 miles north of Indianapolis. The place that I work at is very competitive with the Indianapolis hospital. So we got to be better than the Indianapolis hospitals and for patients to come to us, okay? So we got to be better than those places. And one way that we can do that is to ensure that we have the quality patient care that we need. Joint Commission, so there is a direct correlation between patient experience and Joint Commission standards. Again, they look at our quality. There's a direct correlation between quality and patient experience. Malpractice rates, so we'll talk about that here in the next coming slides, but there is a correlation with that too. So patient experience is very important. Again, we'll talk about employee satisfaction, and that generates into patient satisfaction. There's a lot of people that come to me and ask, well, hey, how do I get my patient scores up? And the first thing I tell them is, well, you got to work on your employee satisfaction first. And a lot of people don't understand that or don't realize that, but you got to have engaged employees before you work on your patient satisfaction. And I'm not saying that you should spend hours and days and months and years on employee satisfaction, but you got to still work on that. And I'm working right now with our med surg director we have at the hospital, and the employee or the patient satisfaction scores are pretty much terrible at our med surg department. And there's been a lot of turnover in the med surg department, things like that. And I'd say, well, the first thing you need to do is you need to work on your employee satisfaction first. So you got to have the engaged employees in order to have high patient satisfaction scores that you need. And again, I said I'm a nerd, so I do like to read, but this Patient Comes Second book, that's a great book. So I got this, my HIS director, health info, the medical records director, she's the one who told me about this. And it's like, well, I'm not going to read a book that says patients come second. I mean, patients don't come second, patients come first. And she's like, no, you got to make sure that you read it. It's like, well, okay, I'll read it. So the whole premise of the book says that, in order to increase patient satisfaction, you got to make sure you focus on your employee satisfaction. And that's definitely true. So I definitely agree with that. But that's a real easy read for all of you who like to read. So you want to increase the employee satisfaction? Well, I'm going to give you a few tips here. And these are just things that I've learned throughout my years. And I talked about this during our ICE leadership meeting today. Know your employees. So I think it's important that everybody knows their employees, not only on a professional basis, obviously that's important, but on a personal basis also. And how do we do that? Rounding. I tell you, I can't, and I talked about this too at our ICE leadership, but rounding is so important. I can't stress how important rounding is. You need to round, in my opinion, every day. And when you talk to your employees, I mean, there's times that I talk about work, but there's times I talk to them about a personal level also. But rounding is so important. You kind of get a pulse of what's going on with your employees. I have very few meetings in my departments. My personal opinion, again, this is just me, but if you round with your employees, you really don't need to have a meeting because you're already kind of telling them what's going on anyway. So again, that doesn't work for every facility or every director and all that. I totally get it, but it's just what works for me. But rounding to me is extremely important. Make them part of the solution. So before I left, we had an issue with our ultrasound techs where the ER doctors weren't ordering a UPT before their pregnancy or for the ER ultrasound. So I kind of worked with them, kind of developed a plan, and we came up with something. So make the employees part of the solution. That could be part of the solution. There's times, and we all get this, where employees come to our office and they complain about this and that. First thing I tell them is, okay, what would you do if you're in my position? And they usually offer a solution that way. But make them part of the solution. Make sure you practice what you preach. That's important. We'll talk about this a little bit later, but practice what you preach. When I go see someone, or when somebody comes to my office, if it's a sales rep or maybe somebody that's outside of my hospital, I always walk them out of the department. Because why do I do that? Because I want my employees to make sure they walk the patients out of the department. Okay, so it's so easy to say go down the hallway and turn a left. I mean, come on, we can do way better than that. Okay, so make sure you practice what you preach. Listen. So if you talk to my wife, I'm not a good listener, but I don't know if it's a husband thing or not, but I get in trouble all the time for not listening. But of course, I think I'm in trouble about 90% of the time. But probably just a husband thing. I don't know. But make sure you listen. And one of the things that kind of a good body language for listening is you turn your head to the side. That's a sign of active listening. And we have an ER physician that's really good at this. I don't know if she does it on a conscious level or a subconscious level, but she does turn her head to the side when patients are talking. And that really increases her patient satisfaction scores. Now, I don't think that's 100% all of it, but I do notice her doing that. Celebrate. I think celebrations are important. What I do with my staff is that if we meet our patient satisfaction goals, then we have a celebration. So I used to buy them lunch, but man, lunch is expensive anymore. It's like $7-10 a person anymore. So kind of stopped doing that, and now I just buy them Dairy Queen, the ice cream cakes, which I love those ice cream cakes, but which they're expensive too, but not expensive as lunch is. But anyway, that's kind of how we celebrate, and I think it's important that everybody celebrates. And one thing that I really love to do is I love to have fun with staff also. I don't think there's any HR lawyers that's in this room right now, but I had all my employees come to my house. I kind of threw a little party for them. Our patient satisfaction scores are really, really high, highest that they've ever been. Let's see, that was pre-COVID, of course, but they're as high as what they ever been. So I threw a party at my house. I have a pool table down my basement, and we played pool, played games up till 1, 2 o'clock in the morning, and it was good, honest fun. You know, we didn't get too crazy or wild, or nobody, you know, complained or hit each other or nothing like that. But we had a good time. And one thing that we're doing too, I don't know how other places are, but it seems like there's always kind of a disconnect between the radiology department and the ER department. So I've kind of talked to the director and what we're going to do, and that's if COVID settles down a little bit. But we're going to have a softball tournament between the radiology department and the ER department. So that's just a way to kind of get it, you know, people together, kind of have more fun, things like that. So hopefully we can get that started. We're kind of planning a date in the in late fall to get that done. But we're looking forward to something like that. But make sure you have fun. You know, life's too short not to have fun. Just because you're a leader, a director, a manager, that doesn't mean that you can't still have fun with your staff. RSNA is a good time too. It's a good time to have fun, you know, the games and things like that. You can play for that. So talk about the profitability, and I'll go with, and I'll kind of circle back to the employee also. But this is a graph here. This patient satisfaction's here. I believe that's the y-axis, and I think this is the x if I remember right. But what this shows you is that your if your employee satisfaction is high, your profitability is going to be high too. Okay, because why is that? Because people want to come to your place. You're going to have better quality measures, things like that. You're going to get reimbursed more from the government, things like that. So there is a direct correlation. And I should have made this section smaller here, but engaged employees, I just talked about that. It fuels a cycle. So you have the engaged employees is going to be the great customer service. It's going to be the loyal customers. Loyal customers bring to strong financials. When strong financials happen, you can invest in your employees. You can give them the raises, things like that. And that's all leads to lower employee turnover. And we all got into healthcare for one reason, that's to take care of the patients. I never realized that healthcare was a business per se until I got to be a director. And it's like, wow, this is kind of a business, you know, we're out to make money. We know we need to make money because, you know, we don't want to hire Superman here to be stand in for our x-ray machine. So now if you see at the bottom that he's been kind enough to stand in for us till we can afford a new x-ray machine. So we don't want to hire Superman. So we want to make sure that we're profitable. This is malpractice. I kind of talked about that. Basically, the premise of this is saying that patients don't want to sue their physician if they're happy with their physician. If patients are happy, they don't want to sue someone that they don't like. Okay, so there is kind of an inverse proportion of that. So if patients have, or if the physicians have high patient satisfaction scores, they're going to have lower of the lawsuits because again, people don't want to sue people that they like. All right, here's the Forrest Gump trivia here. Here we go. So what did Forrest Gump say next? So he's meeting Kennedy here. Somebody said that. Who was it? There you go. I gotta pee. And he met Kennedy because of why? I said, why did he get invited to the White House?
For ping pong.
No, he didn't. No. No. Making the All-American team in football. Yep. All right. Enough about that. So Scanxiety, that's what we're going to talk about. We're going to spend the majority of our time with this. So Scanxiety, it's a relatively new term. It's anxiety and worry that accompanies a period of time before undergoing or receiving the results of a medical examination, such as a MRI or a CT scan. So when patients come into the hospital, I'm talking about strictly with imaging here, but it can be with anything. Patients are automatically anxious, and it's up to us as healthcare workers to try to decrease the anxiety level for our patients, okay? And the Scanxiety, that's one way that we can try to do this. We gotta lower the Scanxiety level for the patient. And basically the Scanxiety level It's kind of a 5-step process here, okay? So the referral part is when the patient is getting referred. So that's when the patient's in the doctor's office saying, hey, we're going to order this radiology test on you. The scheduling, that's when they actually get scheduled for the actual test. The registration, that's when they're at the registration window. Procedure, we're going to talk a lot about the procedure phase because that's one of the phases that we as imaging professionals, that's one of the phases that we can really work on the most and we have the most impact on. The follow-up, that's basically the turnaround time for the reports, things like that. So the whole goal throughout all of this is to decrease the Scanxiety level for the patient throughout all of this, okay? So I'm going to talk about ways that we as professionals can help decrease the Scanxiety level throughout all these phases. So we'll talk with the referral phase. This is the voice of the patient. I'm not sure why the doctor sent me. How much will it cost? What will happen to me? Will it hurt? So what do patients want? They want the info. And I will say that I'm a huge proponent of videos. I love the concept of videos. So for instance, if a patient is going to have a barium swallow test, what we do is that we send out a video to the patient to their email, and then they watch a video about what's going to happen to them while they have this particular test. So we were going to do this. This was, of course, pre-COVID. We kind of had everything all in line in order to do this. But, you know, COVID hit. We didn't have the money that we used to, so that got put on the back burner. But we're going to try to implement that. But I think, you know, we learn so much on YouTube anymore. You know, I know that, see, a couple months ago, I had to install a toilet because our toilet went bad. So the first thing I do is I went on YouTube to see how to install this thing, okay? So again, I think videos are important. Now that the handouts, I mean, they're good too. However, the thing about the handouts is I think that anymore people are more focused on the videos. They really don't want to read. You know, they want something quick. They want something easy. So I'm a huge proponent of the videos. If anybody wants some more info, then just you know, call me or contact me or whatever. I can get you the name of the company. But videos are very important. Price transparency, that's what people want in this particular stage. They want cost, you know, how much is it going to cost? I will say that I don't think we do a very good job in the healthcare field for communicating to patients about how much an exam or how much a procedure, how much of a test is going to cost. There are some websites you can go on. There are some places that, you know, they're kind of buried in the websites of the local hospitals, but you can find the prices in those, but they are difficult to find. But patients want that. They want to say, hey, it's low cost imaging. Do I need to go there instead? So this is kind of a graph. I said, did you seek the info about an imaging test before consulting with your doctor? 37% said yes, 63% said no. So they didn't seek the info. I think that's kind of sad. I think that they need to be more informed. We got to do a better job of informing patients. And a lot of times we think that's the physician's office to do that, to explain the test, which I don't know, I mean, it probably is maybe. But from an imaging standpoint, we got to make sure we explain the test before the patient gets here. Because so many times when I worked at the technologist, the patient had no idea what's going to happen to them, you know, and it's sad that happens. So the scheduling, that's when they're actually scheduling the actual test. So the voice of the patient, I wish it was easier to schedule. Why does it take so long to schedule my test? It takes forever to pre-cert, the lovely pre-cert. So what patients want, they want easy scheduling. And does anybody do self-scheduling for exams? Oh, you did? Good, good. That's, I'm very jealous of you because I love to do the self-scheduling. So I assume the patients go on a website and they schedule it that way. Is that how they do it? Oh, really good. So do patients like that? Still early. Okay. Yeah. So how's pre-cert work with that? I'm just curious because I mean, does the patients get pre-certed before they? Yeah. Oh, really? Oh, wow. Dang, that's awesome. Yeah. Wow. Yeah. The thing we have with our schedule. Hmm, yeah. Wow. Yeah, that's awesome. Do you know what company it is? Luma. Okay. Hmm. All right. I gotta make sure I remember that. Did you have a question or do you have a comment? Oh, okay. All right. Good. Yeah. Yeah. That's awesome. Yeah, Mike. Yeah. Okay. So just mammo and bone density. That's it. Well, yeah. Yeah. There's not too much. Okay. Hmm. All right. Well, that's interesting. Wow. Okay. Well, that's cool. Yeah, I love the concept of self-scheduling. You know, it kind of puts it all on the patient. So that's pretty cool that people are doing that. So I really like that. They want convenient times too. You know, whenever I make a dentist appointment, I always try to make it of the first thing of the morning or later. You know, because it's hard for me to get off work and all that to go to the dentist. I hate going to the dentist, but you know, you gotta do it, I guess. Pre-cert, they want the pre-cert quicker too. So the outsourcing, I think there's some people that are outsourcing it. We don't outsource it at ours. It's supposed to be make it quicker if you outsource it. I don't know if it does or not, but it's what it's supposed to be anyway. They want a short duration too. So when they schedule a patient or they schedule an exam, they want it done as quick as they can. My dad, he passed away from cancer a couple months ago. And for my dad, he wanted to get done quick. You know, he had a PET CT. He wanted to make sure that PET CT was done quick. The PET CT kind of is at the beginning, kind of, you know, tells them how to treat the patients, things like that. So we want that exam done. We want it done quick. So 61% want minimal wait time to get their procedure scheduled. That seems a little bit low to me. I would think that'd be a little bit higher, but that's the data that I found. So, but yeah, so the main thing is patients want to be easy, quick, and get done as quick as they can for the scheduling portion. The registration, this is where they go and register, and this is where they spend the time in the waiting room, things like that. So the register, so the voice of the patient, you know, I had to wait 15 minutes before they called me back. Wish the registration person was nicer. Why did it take so long to register me? No one had an answer. So what patients want? They want very minimal wait time. And this is kind of my pet peeve to a certain extent, that when patients do have to wait, make sure we inform them why they have to wait. Make sure we inform them that they are waiting, that we're going to get to them as quick as they can. You know, I totally get it. I mean, you know, especially in a hospital setting, even if you're in an outpatient setting, you know, you get bombarded with ER patients, with inpatients, with this and that. So, you know, it's tough to run on time on certain things, but we got to make sure we have the processes in place. If we're consistently running behind, you know, do we need to get more staff? Which, good luck with that, right? Do we need to get more staff? Do we need to make the scan times, you know, shorter? Do we need to make the appointments longer? Things like that. But make sure you inform patients. And this is what I tell people when I talk about this, is that if you always over exaggerate a time. So for instance, if you think it's going to be 10 minutes before you get the patient, tell them, you know, we're going to get to you in 15 or 20 minutes. So what's that do? It kind of, the expectation, it exceeds your expectations, because in their mind, they're thinking it's going to be 20 minutes, they get there in 10. So always kind of over exaggerate when you're dealing with patient times. Now you don't want to over exaggerate a lot, right? But you always want to try to over exaggerate the wait time. So for those of you who've been to Disney, which I'm sure the majority of you have probably been to Disney, if you're ever in line at Disney, it'll say from this point on, you got 20 minutes. But if you check your watch, it's usually never 20 minutes, usually like maybe 5 or 10. But again, Disney does that for a reason, because the expectations are like, wow, it's supposed to be 20. Well, I got here in 10. Wow, that's pretty cool. You know, so, but again, if the patients have to wait, make sure you inform them of the wait. Most people pre-register now. I think that's fairly common. Sometimes you can't, but if there's a way that you can try to get them to sign a consent sooner, or maybe before they even come here, then that's even better. Empathy, we're going to talk a lot about empathy, but patients want the empathy. We're going to talk a lot about that, like I said. 53% want minimal wait time in the waiting room prior to the exam. I don't know, to me that's a little bit low, but if it was me, I'd be like in the 90s. But so this is where we're going to spend the majority of our time on the Scanxiety portion of my presentation here. And this is the part where we're actually scanning the patient. Okay, so we're in there, we're actively scanning the patient, we're getting the patient, things like that. So this is the voice of the patient. Sorry, whenever I'm in conferences, my throat always gets dry. So the voice of the patient, I was really claustrophobic during my MRI. The technologist was not very friendly. I received no explanation of what's going to happen. So what's the patients want? They want comfort, and the room design is very important. There's a lot of companies out there that do like the fancy lighting and all this and that, and I think that's pretty cool that we have companies out there that can do that kind of things. We have that at a couple of our sites. We have that. I've always kind of been a big proponent of natural light. I'd rather have the natural light than the lighting. Now that's just me personally, but in our one facility, on our one MRI, we have the natural light. So we basically have a row of windows like this. And then for like the breast exams and things like that, we can actually fog the windows, and that's pretty cool, you know. So that kind of gives them more privacy and things like that. But I just like the concept of natural light better. We have like a courtyard out in the back, things like that. Plus, it's a little bit cheaper too than paying for the lighting. But the lighting is still pretty cool. But you know, make sure you always think about the room design. Music. So is anybody here from Advent Health? Are you which hospital are you on? Is it okay? So Celebration Health. Are you familiar with them? So I love their MRI suite there. You ever been to their MRI suite? Okay, yeah. So it has like a beach theme when you walk in there, and it's like really cool. So I went to a Disney conference on patient experience January of 2020, and so we took a tour through Celebration Health, and the MRI was really neat. I was really impressed with it. It's all like a beach theme. When you walk into the waiting room, so not the main waiting room, so it'd be like what, area 2 or zone 2? Yeah. So it's got like the music going, it's got like the seagulls going, and it kind of feels like very beachy and all that. The waiting rooms they're like beach themed too. I mean, it's really neat. Yeah, they do. Yeah. I wish I would have put a slide or a picture up there, but it was really neat. I was like really impressed. But I'm thinking, well, why can't I do that at my facility? You know, and I can, but of course, it's this. But yeah, I think that's how they got at Celebration Health when I was there. Their foundation, I think, paid for a lot of that. But yeah. So that's pretty neat. Yeah. So anyway, I just thought that was kind of cool. Empathy, like I said, I'm going to talk about this a lot, but hard and aided, that's important when we're dealing with patients. Communicate. You can never communicate enough, and it doesn't matter if you're dealing with patients, whether you're dealing with staff, whether you're dealing with your spouse, kids, whatever. We can never communicate enough. We got to communicate every single step. I thought this was interesting, and I definitely believe that 75% of patient comments related to staff behavior. I definitely agree with that. Over 50% of comments related to the technologist. Over 3/4 of patients say the quality of human interaction is the most important. That's without a doubt all true, I believe. Again, that's the caring portion of our brain that uses that. So the procedure aspect. These I'm going to kind of give you guys some helpful hints and some things that I've learned and the things that I've done some research. And these are the things that I teach my staff how to do. And we'll go into the teaching portion here in a little bit. But what I tell staff is that you should go get the patient instead of them getting you. So in other instance, if I'm going to call Carrie Styles' name in the waiting room, I need to come and get Carrie instead of Carrie coming to me, okay? It just kind of gives you more of a welcoming effect that way when you go get the patient instead of them coming to you. Always never walk ahead to the patient. So when I first started at my place of employment, you know, the technologist was here and the patient was here. And I'm like, that just drove me crazy. It's like a dog leading on the leash, you know. So we can do a lot better than that. You gotta even it up, okay? So you should be walking side by side with your patient the whole way. Engage in some kind of a conversation when you walk the patient back. So I tell people, I don't care if you got to talk about the weather. I don't care if you got to talk about their shoes. I don't care what you talk about, but make sure you engage in some kind of a light conversation when you walk the patient back, okay? Again, it's not all that hard. Human business human. So I talked about being at Disney. So when I was at the Disney conference, they kind of took the Disney concept and they made it into the patient interaction, the patient experience. And Jake Poore is the guy's name, Jake, and then Poore, P-O-O-R-E. He was the one who led that. And he really focused on the human business human. So when you interact with someone, you should interact on the human side first, then you go to the business, and then you end on the human. So for instance, if I'm going to explain to them, I use MRI a lot because I'm an MRI technologist by background, but kind of how I would do that. So the human, so I would say, you know, hey, Carrie, I mean, I'm Jason. I'm be doing your MRI. I've been doing this for many years. I'm going to slide you into the MRI. I'll go through the whole MRI process. And then on the very end, I'd say, you know, do you have any other questions for me? Is there anything else that I can answer? You know, thanks for being a part of my patient load here. You're great. So make sure you do the big human business human. Again, I think that's important. We'll kind of talk about that as time goes on too in this presentation. Explain, explain, explain. You can't explain enough. Okay. Again, the communication, you can't explain enough, things like that. Well, I remember when I first came to Witham, to the job that I'm at now, had to get a physical, and went back and with the nurse, and she just slapped the blood pressure cuff on me, didn't tell me what she was doing, things like that. I'm thinking, what the heck, you know? So always make sure you explain every single process. When you get ready to start the IV, you know, hey, you're going to feel this tight band around you, things like that. So explain the whole process. And the thing is that this stuff here, I mean, it's simple stuff, right? I mean, it probably, some of the stuff takes like maybe 10 seconds to actually do. But the thing is, a lot of places don't do this. Okay, so again, this is just simple stuff. Name tag on the left and commit to sit. So you should be wearing your name tag on your left. Now we got lanyards here now, but does anybody know why you should wear the name tag on our left? I stumped people. Very good. I should give you a ping pong ball, but I don't have any more. Well, I got two more, but they're for later. Yeah, your heart's on your left, so you should wear the name tag on your left side, and commit to sit also. And I'll talk about that. So this is so I'm not a very creative person, so I can't create anything. But a person that's on my patient experience team, they created this, and this is a screensaver that she kept, and this is the way that we kind of promoted the commit to sit and name tag that's on your left. So we kind of explained to this that the badge on your left, why it's a clear sight for patients, family visitors. builds a connection. So you can't connect with someone if you don't know their actual name. So, and your heart's on your left side. So very good, Nathan. So we put this on all the screensavers throughout the whole hospital, and it did generate a lot of buzz. You know, it kind of gets in people's mind. Commit to sit. So I'm really big on committing to sitting. So whenever you go and talk to a patient, you should always commit. So if I'm going to talk to Justin, I want to make sure that I sit down in order to talk to Justin. So why do I want to do that? Well, it kind of puts the patient and the caregiver on more of an even level. It's not as intimidating. So if I stand up, it's a little bit more intimidating for the patient. So always make sure you try to commit to sit if you possibly can. Now, I know that there's times, especially in radiology, we're very kind of a task-oriented place, but you know, I totally get it. There are going to be times where you can't commit to sit. But if you can, then make sure you try to do this. So one way you can commit to sit is when you're doing, when you're talking to patients about their consent, you know, if they got to sign a consent in IR, you know, make sure you sit down with the patient. I mean, you know, if you got to go buy a stool, go buy a stool. I mean, they're not that expensive. So, but make sure you try to commit to sit with your patient. It's less intimidating for the patient. Again, if it's the caregiver and the patient on the same level. And when you do sit, it kind of sends a name, or it kind of sends a kind of a voice to the patient. It kind of says that you have more empathy, you're better communicators, and that you listen more. So again, it's very important to commit to sit. There is a nice article in Radiology Management, and Carrie's the editor of Radiology Management. Everybody wants to write in an article, so she's very good. But anyway, there's a very good article on commit to sit in Radiology Management. I think it was sometime last year. But procedures, so make sure that you smile even with your mask on. So does anybody know who this stud here is? Very good. Very good. So am I happy there? Do you think I'm smiling? Man, you guys are quiet. I heard somebody say yes. Yeah. So don't tell me that if just because you can't see the patient's face or you're the healthcare person's face that they're not smiling. So make sure you always try to smile, even with a mask on. So this is me getting my COVID shot there. So eye contact is very important that you maintain eye contact with a patient. You know, whenever you're talking to them, make sure you try to maintain eye contact with them. Physically walk the patient out of the apartment. I've kind of talked about that, but that's kind of one of my pet peeves. Don't ever say, go down the hallway and turn a right. I mean, come on. Manage up. And John, can you show that video? So when I say manage up, just kind of bring it up and then pause it if you can pause it. So when I say manage up, so what I mean by that is that when your next caregiver comes in, make sure you try to manage up. So for instance, one of our physicians is Dr. Fritz. He does the breast biopsies. And a lot of people are really anxious, especially, you know, when they're doing a mammogram, and especially when they're having some kind of interventional work in mammo. But what our technologists do a very good job of managing up Dr. Fritz. So what they'll say is that, hey, you know, Dr. Fritz has been doing this for many, many years. He's a great physician. He's going to take excellent care of you. So what that does for the patient, they're like, well, I guess I'm in pretty good shape now, you know. So it kind of puts that thought in their mind. So make sure you always try to manage up. And when I was talking about managing up, I saw this commercial, and I thought, hey, this is a great commercial about how to manage up or how not to manage up. So can you play that?
Have you ever worked with Dr. Francis? Oh yeah, he's okay.
Just okay?
Guess who just got reinstated? Well, not officially. Nervous?
Yeah.
Yeah, me too. Don't worry about it. We'll figure it out. I'll see you in there.
Just okay
Yeah.
is not okay. Especially.
So that's what you don't want to do, okay? So yeah, when I first saw that commercial, I thought, wow, that's pretty cool. So if you notice that the look on that guy's face, he was like worried, right? So body language does matter. If you read certain articles, they'll say it's over 70% of communication. That's probably true. But, you know, again, body language is important, but make sure you try to manage them up. When I always try to help out if we get busy. And whenever I take a patient out back to the emergency department, I always say, hey, you know, John is your nurse. John's going to take great care of you. He's been here for many, many years. Or I say, you know, hey, the ER, they're fantastic. They're going to take excellent care of you. Okay. So I always try to manage up the next department, the next coworker, the next physician, things like that. Because why? Because patients are automatically anxious. Okay. So we need to, again, decrease the anxiety level for that patient. So make sure we always try to manage up. Empathy, again, that's so important. I can't say enough about how empathy is so important in healthcare. A gentle touch. So for instance, if I'm going, what I always do when I do MRI, and I work PRN at an MRI facility on the weekends. And whenever I take the patient inside the MRI scanner, I always touch their leg. So I just give a gentle touch on their leg. Hey, you gonna be okay? Things like that. So make sure you always try to do some kind of gentle touch. Now, you know, you don't want to group the patient, obviously, but always have some kind of a gentle touch when you deal with patients. You know, patients are anxious, so we got to try to decrease that anxiety level for that patient. So this is very important too. Respond with empathy first before a solution is offered. So what I mean by that, let's say a patient has a headache. Before you say, okay, I'll give you some aspirin, say, oh, you know, hey, that's not easy having a headache. Let me give you some aspirin. So, you know, make sure you respond with empathy first before a solution is offered. And it doesn't matter if you're with patients, whether you're with just your coworkers, whether you're at home, you know, your personal life, professional life. Always respond with empathy first before a solution is offered. That's very important, you know, and times too, like with MRI, like I said, I use a lot of MRI examples, but, you know, patients say, hey, I'm scared of this. And what I say is, okay, hey, I know it's, you know, it's not easy being scared, but, you know, I'm going to try to put a cloth over your eyes. That shit should really help out. You know, we'll make sure that we get you through this. So if you noticed, I used a human, business, human when I was explaining that, okay? So again, kind of keep that in your head, human, business, human. Empathy, this is a definition of empathy, I mean, whatever. But it says here that, you know, it's basically putting yourself in your patient's or your employee's shoes, okay? So that's empathy. And one thing that we have to try to understand is I've been in healthcare for 20 some years, and I totally get it. There's some patients that are difficult, okay? There are a lot of patients that are difficult. The one thing you got to always understand that's somebody's relative, that's somebody's, you know, family member, mom, dad, whatever. And I always try to keep that in your mind, okay? This is how patients experience care. I don't know how you guys can see that in the back, but what patients want the most is teamwork. They want teamwork. They want culture. You know, want to make sure we have a positive culture. Kind of in the middle here is where this is the care portion, where that comes in. You know, they wanted the pain control. They want their pain in control. The environment. You know, they want the wait times to be decreased. Things like that. Kind of the tip of the iceberg is the caring behaviors. Okay, so again, we're using our different sides of our brain here, right? So they want the caring. This is the care down here. Patients want the caring. And at the very tip of this is empathy. Patients really want empathy. We got to respond with empathy first before a solution is offered. This is another great book. It's all in the delivery. It said I, but it should be, I shouldn't be there. But anyway, again, I'm a big reader, but when I saw this, I thought, wow, that's really good. But only when patients can feel the compassion can they trust that their healthcare provider had their best interest at heart. And what I mean by that is I'm going to go back to the example of my dad. You know, my dad had cancer. And one thing we really liked about the physician, about his cancer doc, is that he really showed a lot of compassion. He sat with us. He offered the gentle touch. He did those kind of things. He assured us. And then when he did all that, we could trust him, you know, and that's what patients feel like. When they have, when patients can trust their providers, they're going to have a lot better of the outcomes. And, you know, that's important. They got to feel the compassion. And the compassion is part of our empathy. It's kind of a good cartoon. I think you'll find I'm one of the most empathetic doctors around, so can't see that. But empathy is so important. These are some more empathy behaviors. Acknowledge suffering. Again, make sure you respond with empathy first before a solution is offered. Body language is so important, okay? Make sure you maintain body language. One thing we tell people too is try to talk heart to heart with someone. So if I'm talking to Carrie, I want to try to talk heart to heart with Carrie, not like this, okay? When you talk heart to heart, it just kind of says, hey, I'm with you, things like that. So make sure you try to point your heart to the patient's heart. Care versus caring, we talked about that. Managing up, again, managing up is really important. Decrease the anxiety level for the patient. Caring transcends the diagnosis. Again, the care is important, but we also want to be part of the caring. The connection, I thought this was interesting here. It takes 56 seconds to make a connection. That's not very long. That's less than a minute. And one thing that I tell the nurses, or even tell the x-ray techs that I work with, is that when you first walk into a patient room, kind of do a survey and see what's in the patient's room. If they have flowers, hey, I saw you have flowers. Those flowers from someone, So always try to look around. And if you're a sales rep in here, when you come to someone's office, try to look around in their office and try to strike up a conversation. Hey, I saw where you have kids. You have 3 kids, 4 kids, whatever. So I always try to look around and try to make a connection that way. But again, it doesn't take long to make a connection. One thing I tell people too is to make sure that they knock before going inside of a patient's room. So make sure you knock first. Not very good knock. It must be a solid table. And then ask to go inside the patient room. So if you're bringing up a portable to the patient room, always knock first and ask to go inside the room. Sorry. This is heart. This is how we respond to concerns and complaints. So heart's a very good model. I use this on a daily basis, and the Cleveland Clinic is who came up with heart. And heart is an acronym where you hear the story, you empathize. Again, empathy is important. Apologize, respond, and then think. So when I look at our patient satisfaction scores, a lot of you who are directors will get a priority index. And it kind of tells you, something to use the most bang for your buck is the priority index of what that you can do to increase your scores. And I see heart, I see the responding concerns and complaints. I see that a lot, at least on my surveys. But this is how you respond to a concern or a complaint. So somebody give me a concern or a complaint, and I'll respond with it using the heart model. And I'll wait forever if I have to. Exam took too long, so that's definitely a good one. So H is that I would listen to that. I'd say, hey, I know it's not easy with your exam being so long. I apologize for that. Let me see what I can do about that. Let me go get a hold of the radiologist, and I will get that read for you quickly. Thank you for telling me that. So that's kind of the heart model. That's kind of a short and dirty version of that. I could go on and on if I want to. But that's the heart model. Again, this heart model can be used with anything, anybody, whether you're professional or personal life. It does work. So I would tell everybody to, if you have any kind of issues with the concerns and complaints, then use the heart model because it's a very good model to use. AIDIT, I'll talk about that here shortly. I'm sure a lot of people have probably heard of AIDIT, but this is how you interact with patients. So A is you acknowledge, so make sure that you greet the patient. So if you're going to go to a patient's waiting room, make sure that you greet the patient. Again, make sure you go get the patient instead of them getting you. Also, make sure that your room is ready. Patients don't want to go inside of a dirty room. If they go inside of a dirty room, then they'll say, man, this hospital is not very good. It's a bad department. Make sure your room is ready. Make sure it's prepped. Make sure it's ready to go. The introduce, manage up. So this is a hard thing to do for us as healthcare people, but what we want to try to do is want to manage ourselves up too. So what I would do is if I was going to a patient, hey, I'm Jason, I've been doing MRI for over 20 years, I'm a registered technologist, I'm going to take excellent care of you. So that's managing you up. And again, you're not trying to brag, you're just trying to decrease the anxiety level for the patient. Now, I know that's very difficult. It's hard to talk about us, right? But you know, if something happens and you don't feel comfortable talking about that, try to manage something up. You know, hey, we got great equipment here. We're going to take great care of you. You know, again, I kind of use the thing with the radiologist. You know, he's going to be an excellent radiologist, going to take good care of you. But I always try to manage something or somebody up. Duration, you know, that's time. So hey, this CT is going to take about 5 minutes. Won't be in there very long. You'll be in and out in no time. Explain. So make sure you explain the whole procedure. Okay. So explain everything. And then think. So if you see think on the heart and on the AIDA model, again, you want to thank the patient for something. Hey, thank you for choosing Witham as your place to get your imaging test. Hey, I know that wasn't easy to sit on that table, you know, but thank you for sitting on that table. So again, you want to make sure you try to thank the patient for something. This is a good quote here that I saw. And I think this really sums up. So the thing that I really preach is that I want directors, or I want you guys as leaders to make sure that you train your staff about how to interact with patients. Okay, so that's really important. I mean, we can preach, we can do all of this, but until we actually sit down and until we teach the course, let's say, it's hard to hardwire that. And I thought this is a good quote here. Tell me and I'll forget, show me and I'll remember, involve me and I will understand. So I think that's totally right. When you involve someone, it doesn't matter what kind of process it is, or you know, if it's a new kind of process improvement or whatever, they automatically kind of stores that in their mind. So telling them, you know, me being up here preaching for an hour and a half, okay, whatever. But if I involve you guys, then that's a little bit better. So that's what I'm going to do. So I need a volunteer. If not, I'm going to pick someone. All right, Andrew. The Kentucky shirt. I don't know why you got that on, but so I'm going to do a good and a bad as far as how. And this is how we need to. And I'll do this short because I don't have too much time left because I still got a lot more to go. This is what you as leaders need to do to train your staff, okay? So I'm gonna pretend like Andrew is in the waiting room, and I'm gonna go get Andrew for his chest x-ray, okay? Andrew Brinkman? Yeah. We're all ready for your chest x-ray. Come on back here. All right, you sit over here. We're gonna get this gown on. You get the gown on when you're done, just come outside. Okay, I guess she's done now. Hey, that's like Superman. All right, come over here. Put your chest up against there. Wrap your arms around there. Okay, hold your breath. Beep. Okay, turn this way. Grab that bar. Hold your breath. Beep. Okay. All right. Hey, we're all done. Go over here and get dressed. Again, he's like Superman. All right. Well, we're all finished with it. Just go down the hallway and turn left. So what all did I do wrong besides everything? Yep, didn't go to him. Didn't do that. Didn't maintain eye contact. Yeah. So I did tons of things wrong there, right? So all right, so I'm gonna do a good thing and really watch me because I'm going to do some stuff wrong, okay? So I'm going to go get Andrew again for a chest x-ray. Andrew Brinkman? Hey, how are you?
Good, how are you?
Oh, good. That Kentucky shirt, I mean, I don't know. But anyway.
I like this Music City.
I don't care what you do. All right, well, hey, anyway, we're going to get a chest x-ray of you.
Okay.
So we're going to take 2 quick pictures of your chest, okay? One that's where you're kind of hugging the machine, one where you're on your side. It shouldn't take us too long, probably, I don't know, maybe 5 minutes or so.
Okay.
But before we get started, we got to change out that ugly shirt, okay? So we're going to come over here. So here's a gown to put on. And then when you get done with the gown, just come out here and we'll get you going, okay?
All right.
All right, Superman, he's over here. All right, Andrew, so again, take two quick pictures, okay?
Okay.
So go and put your chest up against there, grab the machine, hold your breath. Okay. Now turn the other way, hold your breath, beep. All right. Well, we're all done, so you're going to go in and get dressed, and I'll walk you out, okay? And he's Superman, so he's getting dressed. All right. Well, Andrew, hey, we're all finished. So thanks for choosing Witham. You're a great patient. They should get the results probably in about 2 or 3 days.
Okay.
So you have any questions before we?
I don't, thank you.
Okay. All right. Thank you. So what all did I do right? Yep. Explain what's going to happen. Yeah. Yeah, I did. And you know, I think it's always good to kind of have some fun with people too. Did I do anything wrong? What's that? Yeah, that is probably true, right? Yeah. Well, I overdid it, right? I mean, you're just supposed to overdo it, right? Maybe, I don't know. I didn't do that, and you're right. Nope, I didn't do that. Yeah. So there was some stuff I just got to make sure that you guys are awake. So yeah. But anyway, that's kind of the things that you need to do. I can go into a lot more detail, but I'm not, because again, we're kind of running out of time here. But so you know, there's a lot of different concepts that you can go besides with training. But I think training is very important, and it will take time. Okay. I mean, it'll take time for you to get through everything. But I think when the leader, when they train people, it's going to have a lot more of an impact than if you were to have someone else do it. And you know, I know that we're always busy and things like that, but we got to put patient care at the very forefront. Okay. So that's how I would do it. Again, I would go into more detail than that, but we have. What did I do with my thing? Oh, there it is. But anyway, that's kind of a short and dirty how we would do it. All right, so we're done with the procedure portion. So now we're going to go with the follow-up. And again, we're still on the Scanxiety topic here. So the voice of the patient, I would have liked to have the results sooner. You know, I want to get a copy of my report. I don't want to come back for additional testing. So what patients want, they want a quick turnaround time. Just like someone said, you know, they want the turnaround time as quick as we possibly can so they can get a diagnosis, go from there. I've taken many calls over the last couple of weeks. Our radiologists have been short-staffed, and it takes them forever to read. So they keep telling me come July they'll have new residents and it'll get better. So I guess we'll find out, right? But they want a quick turnaround time. They want this. If results are on the same day, I mean that's great. And what I would like to do is I'd like to have the mammo results to be read before the patients get out, but I haven't quite done that yet. But I would love to see that happen. But you got to have definitely the process in place in order to do that. But I would love for patients to know what the results were on their mammograms before they leave. Is anybody doing that? Or if you are, I'm jealous. So yeah, and the patient portal, you know, patients want to go to their portal. A lot of places now have a portal. But a lot of things I hear about the portal is that it takes too long for exams to get, or for results to get on the portal, which, you know, I could definitely see that. And that's something that we're working on my facility. The right test, so AUC, so I'm sure a lot of places are probably doing that. We're kind of behind the 8 ball when it comes to that. But a appropriate use criteria, they want to make sure they get the appropriate use. Hospitals rank radiology report turnaround time among its highest priorities. I definitely believe in that. All right, so here we go. Another Forrest Gump trivia here. What? Oh, I just gave it away. I think I did. What college team did Forrest Gump play in college? What football team? What college did he go to? Bama. Roll Tide roll. All right, here we go. You gonna catch it? The Kentucky guy could probably catch it for you. Roll Tide. All right, so culture, we're gonna talk about that here real quick. So the best way to create a positive culture, a positive patient experience, is to create a culture that's based upon patient experience. You got to preach, and preach more patient experience in order to get a positive culture with that. So what's the best way to do this? Again, communication is so important. You got to communicate. Communication is so important. You got to almost talk about this all the freaking time, you know, if you want this to be embedded in their culture. You know, they need to know what their scores are, what their percentile rank is, things like that. So the way you do that is for the leader to make sure they communicate that. Communication is an important part of being an effective supervisor. Well, yeah, that goes without saying, right? So I read this in radiology management coming home from AHRA in, I guess, 2010. I think it was in Vegas that year. But I don't know, for whatever reason, that kind of stuck out to me. Communication is so important. Whenever I interview someone, the first question I ask is that, why did you go into healthcare? And if they tell me, you know, it's for the technology, if they tell me it's the money, then I don't hire that person. What I'm looking for is they better tell me they're in it for the patient, because they're not in it for the patient, they can go work somewhere else. So that's the very first question that I ask all my interviewees that I interview. At staff meetings, I just hold them quarterly, but I'm not a big meeting guy. I think if you round, you really don't need staff meetings, but some people want them. The weekly newsletter, I do a weekly newsletter every week. So every Friday I put out a weekly newsletter. It's kind of what it looks like, kind of a quick and dirty thing, but patient experience, I always put that first. I always tell them what our scores are, kind of tell them what they need to do in order to increase the patient experience scores. But and then I also talk about other things that's going on, things like that. So I do this every Friday before I leave, and it seems to work really well, along with the meetings. Staff needs to know, you know, why it's important, why patient experience is so important. Again, we get paid on our patient experience. Communicate the scores. Make sure that they know what the scores are. Areas to improve. Make sure they know, you know, what areas that they have to improve. Make sure they know the difference between the mean score and the percentile rank, and that takes a lot of explaining to do. But if you round, if you do things like that, then they should know. Again, patients should be treated as patients, not just a radiology exam. So, and again, we're all guilty of this, but hey, there's a chest x-ray in bed 3. You know, why don't we say Susan Smith is a chest x-ray that needs to be done? You know, we don't say that. We kind of think of, you know, rooms as a radiology exam. We need to kind of think more of patients. Departmental goals, make sure we celebrate. Celebrate's important. Again, I've kind of talked about that. A shining star. So when I see things happen, I give I give employees a shining star. I know it sounds corny, but it does work. Raise the goal higher than the facilities believe in better. So we have as our score, we have to be in the 90s for the mean score. I raised mine to 95 for radiology. So I want to be better than the rest of the areas. Leaders need to communicate with their patients. So this is something that I do. If I see a patient in a waiting room, we have a little sub waiting room, especially in MRI. But I go there and I talk to patients. Hey, are you doing okay? You know, is there anything we can help you with? Are you cold? Do you need a blanket? So it's important for you know, our staff to communicate with patients, but we have to also as leaders. So that's something that I've done, and it's done wonders. Okay. So again, these just kind of some helpful hints that I've come up with. The 10-5 rule. So if you walk with me in the hallway, I say hi to everybody. And that's the 10-5 rule. So at 10 feet, you make eye contact, 5 feet, you verbally greet. And you can use this for a patient, family member, or whatever. So if I'm walking in a hallway at 10 feet, you know, I want to make sure I maintain eye contact with that person. 5 feet, I verbally greet. Now, that's kind of a small area in my opinion. So more like maybe it should be 20-10 or something. But again, what we're doing is that we're trying to base a culture based upon patient experience, based upon friendliness, things like that. So it doesn't matter if I see somebody 20 times in the hallway, I say hi to him, or, you know, hey, how's it going, or something like that. So that's something I think that we as leaders, because we as leaders, staff, and even people that aren't our staff, they're always looking at us, to seeing how we interact, okay? So when we use the 10-5 rule, they see us as more friendly, as kind of a, you know, somebody that they can go to, things like that, okay? So 10-5 rule, I think that's important. The communication, again, you teach the class. I think it's so important. If you start something, first focus on the employees, second focus on the patient. And I think it's so important that you teach the class. Again, I've kind of talked about that, but make sure you do that, small group training, you know, things like that. So I think that's important. Accountability, we got to hold people accountable. So we have something called a 3-strike policy. So 3 strikes and you're out, just like in baseball. So what happens is that if we have a employee that keeps getting patient complaints, then the director, the manager, they'll do some research, and they feel like that the employee could have reacted differently to the patient, then we give them a strike. So 3 strikes and you're basically fired. So I've had to use this, especially when I first came in, to try to get a culture that I wanted. Luckily, I haven't used this recently, but we've had some nurses we had to use this too. And I have a 3-strike policy. If you guys want to give me an email, I'll send it to you. But to me, it's a good policy to have. It just shows that, you know, you're in charge of the patient. The patient experience is so important to you. I think it's so important too to make sure that the people are positive. Make sure that they have positive reinforcement. Fill their bucket. So this is another reading article here, or book. How full is your bucket? It's a real quick read. You can read it all in one weekend. But it's a really good article, and book. And it says basically you got to have positive reinforcement. Okay, positive reinforcement is so good. Make sure you fill their bucket. Again, real quick read. Look at the patient satisfaction scores every day. That's something that I do. I look at the comments every day. That might be excessive some people, but that's what gets me through. So I look at each survey. If a technologist is mentioned by name, you know, give them a copy of the actual survey, along with, hey, you know, great job. Thanks for putting patient satisfaction at the forefront, you know, things like that. But give them a copy of the actual survey. We have something called a Bravo board and a kudos corner. This is what that is. So again, I'm not the most creative guy in the world. Actually, I don't have any creativity at all, but somebody at my work does this. So we post positive comments. Here you can't see it, but we post positive comments here. So if I get a patient satisfaction survey and it's a positive comment, I post that. Also have something called a kudos corner down here, and that's for employee. You know, if something happens and an employee works or they take their call, things like that, then they can put this in this kudos corner. And I will say, I think this is really great for staff. There's kind of a competition in our staff about who can get the most positive comments on there. So I think this is a good thing. I think if people aren't doing this, then I think you definitely need to. But then if we meet our patient satisfaction goals, then we take the comments down, and I do a drawing for like a gift card to the perk. We have like a coffee shop type of thing. I do that every quarter. That's if we meet our goals. So again, I think that's a good thing to build a good culture. Make sure that the staff ties, their goals are tied to patient care. One of the things that I put on all my staff is no patient complaints. I know that sounds very harsh, but that's what I expect. I expect no patient complaints. So I put that on every staff member's eval. Mid-level managers, you know, they should be accountable too for the patient satisfaction scores for their particular area. Checkoff sheet, you know, make sure there's a checkoff sheet also for the aid at the heart, things like that. Customer service cards. So every patient that comes into, I got 5 minutes. I'll try. I got to talk fast because I got more to cover. But the patient comment cards, we give that to patients as soon as they're done with their exam. And that gives them a chance to talk back, but they're reminded to give all 5s on the patient satisfaction. This is kind of folded up, and I forgot to bring these with me, but this is all kind of folded up in like a paper or whatever. But towards the very bottom here, we say, feel free to give us 5s. Now, 5 doesn't mean that we're great. It just means that we've done a very good job. So I think that's important to write in there. You can't see it, but this has the discharge instructions on here, and that's on the very back. Has the name of the employees that took care of them. People want a copy of this, just send me an email and I'll make sure I give that to you. All right, this is my last one. So me and Jenny, we're like peas in what? Okay, I don't know who said that first. Brenda? That's an easy one. Yep, oh, there you go. Peas and carrots, there you go. All right, so we're coming to the conclusion here. So one thing we need to know is that everyone is part of the patient experience. It doesn't matter what goal or what role that you're in, we're all part of the patient experience. Employee experiences, that's important. Again, if you want to start up a patient satisfaction program, work on the employee experience first. Care versus caring, there is a difference, the right brain and the left brain. Financials, make sure that staff know about that. Make sure that you know how important the financials are to your patient experience, because there is a direct correlation between patient experience and the financials. Scanxiety, we went through all 5 steps of that. Know it exists, knows the ways to decrease, do the helpful hints. Again, go getting the patients, that them coming to you, walk them out of the department, things like that we've talked about, explain. Culture, accountability, that's the key. Again, I keep preaching about training sessions. That's definitely good. Make sure you spread the good. If somebody does a good job, make sure you acknowledge that, okay? So finally, the patient satisfaction scores, to try to increase them, starts with one person. Who's that? That's the leader. Leadership is 99% of all efforts. I think that's 100% true. This is a good quote here. People will forget what you said, people forget what you did, but people will never forget how you made them feel. And I think that really wraps up the patient experience. I think that's so true. All right, so I want to give everybody a high five for hearing me for the next hour, or for the hour and a half that I've talked. So give everybody a high five for being there with me. This is my contact info here. And thank you. So I appreciate it. Very good conference. Nice seeing everybody here. If you have any questions or whatever, then we're out of time. Well, we got a minute, but all right, we'll be done. Thanks.